Hi there, it's Dr. Desai from RestorePDX, and today we're going to be talking about total knee restoration. And so this is a concept and a process that we're doing here at RestorePDX to help patients with knee arthritis. And what I'd like to talk about is how we're different from other providers that are doing this, and why we feel like it works better than simple knee injections. Even if you have the best stem cells in the world, there's a specific way of treating someone that we can have better outcomes. So when you look at a patient with knee arthritis, what is arthritis? That's loss of those nice cartilage surfaces. So if we look here, this is a model of a knee, and you can see this bright surface, this white surface, that smooth surface, that's the articular cartilage. This is the femur, and it's connecting to the tibia, and the blue things are the cushions, the meniscus in the joint, and this is a healthy knee. This one, which looks really angry, and you can see all of the wear and tear, this smooth glass surface is now wearing out. That's loss of cartilage, and then the red areas are there to indicate kind of the inflamed areas of the cartilage and the underlying bone, and that's arthritis. Why does arthritis occur, right? You get this is like a nice smooth corian surface on the countertops, and this is one that's been, the formica is breaking down, and you have all this inflammation, the surfaces are irregular. And why that happens is a loss of the cushioning. So oftentimes the menisci, the cushions in the knee, start to tear, and they wear down, and the cartilage rubs on each other and starts to break and fragment. The other thing that can happen and that we see is these dense ligaments that are holding the knee together. On the outside, you hear of the medial collateral ligament and the lateral collateral ligaments. And then on the inside, you hear of the anterior cruciate ligament and the posterior cruciate ligament. All those are dense cord-like structures that are holding the knee together and stabilizing the knee. As we age, unfortunately, those ligaments start to get loose and the knee gets lax and it feels kind of wobbly. And so there you start to develop shear forces, and it tears the meniscus, it tears the cartilage, and you start to develop arthritis. When patients are treated currently with arthritis with injections, even with regenerative medicine, and how I used to do it a long time ago is we would take PRP, or we'd get stem cells, and we'd go into the knee joint and inject the knee joint. And it was one injection, and we'd walk away and say good luck, and people did pretty well. It calmed down the inflammation. It potentially, we're still debating that. Could it heal some cartilage? Could it heal the underlying, inflamed bone? And we feel that it does. But really, it was just very simple technique. What we weren't treating and what we weren't affecting were those ligaments. They were still lax and loose. And so today, when we're doing a total knee restoration, we treat not only the joint, but we're treating all of those ligaments, the ACL, the PCL, the collateral ligaments. And what we see are our patients doing much, much better, both clinically, less pain, but also functionally. They come back and they say, boy, doc, I feel a lot more stable. So those are things that we're seeing with that. So what does that actually take? Obviously, it takes some skill in identifying the structures, both on MRI, because we can identify structures that are weakened, but also, and probably most importantly, is with ultrasound, that we can see and assess the ligaments. We can see damage that sometimes we can't really assess on MRI, and then we can treat that. So when we're treating that, we can use the ultrasound and pinpoint the needles into those damaged ligaments and tendons. And when we treat them, it's very specific and very precise. We're also seeing that when we're following up those patients, they're doing better, but when we look at the tissue itself, it looks healthier, it looks stronger, the collagen is more dense and more compact, and the knee is much more stable. We're also doing treatments of the actual meniscus. It's thought, if you ask most orthopedic surgeons today and most physicians today that are doing musculoskeletal care, there is really not a belief that you can help a meniscus heal. What we're seeing is a different situation, that if we can identify small tears or degeneration of the meniscus, you can actually inject it using both ultrasound guidance and x-ray guidance, and inject the meniscus with regenerative material. And not always, but sometimes we're seeing that meniscus come together and coapt and become much more solid and supportive. So you're regenerating your cushion, right? And so that's functionally repairing the knee. So that's why we like to call it a total knee restoration. So it's not just calming the inflammation, it's not just covering up or masking the pain, but we're actually structurally enhancing the knee and reversing some of the, not all of them, but some of the wear and tear that occurs with age and injury.